I'm Kathy Jameson. I'm the founder of the Jameson Group. I'm so happy to be sharing this webinar with you today on patient consultations, case presentations, and managing the health of your practice. It's a great pleasure to be joining Henry Schein and the Dental Business Institute to give you information of this vital aspect of your dental practice. So with that, let's begin. When we're talking about the health and well-being of our practice, we want to make sure that we understand that every system of our practice is vital to our practice, including, and may I say, perhaps especially, the consultation aspect of our practice. I call it the fulcrum of our practice because everything really springboards from this essential area of our practice. This is my husband, Dr. John Jameson, and he says this: offer the best dentistry possible, make the financing of the dentistry comfortable and affordable, and get out of the way and let the patient have a chance to say yes to the very best. And so if you can do that with your patients, you will be on your way to great success. Sometimes we think we have to imagine what a patient can or cannot do or what they will or will not accept. But I'm going to suggest that you do just as Dr. Jameson says here. Each and every patient, as they come into your practice, look at them as if they're a patient who is totally and completely restored to health. Find out what that patient has come to your practice for. What are their goals? What are their objectives? What is it that they are seeking? What do they want? What do they need? Why are they there? And then do your very best to provide a comprehensive oral evaluation and design a treatment plan that you believe would help them to reach their goals and their objectives. And then offer the very best dentistry possible, make the financing comfortable and affordable, and then get out of the way and let the patient have a chance to say yes to the very best. So as we look at this fulcrum of the practice, the case presentation, it is indeed a system. Just like everything in the practice is a system. Every single part of your practice is built on a system. Your practice is a set of systems working cohesively together, one system folding into every other system, one working to build upon another. Here are the steps that we outline in a healthy case presentation, with the goal, of course, having patients say yes to treatment. That's the goal for all of you. That's what you want, of course, is for people to say yes to the treatment that you are recommending. So the first step is to build a relationship. The business experts will tell us that no one will purchase our product or service unless they have a level of trust and or confidence with us. And of course, we're offering a service to our patients, a healthcare service. We want them to be as healthy and as attractive as possible, and both, of course. So we must have wonderful relationships with our patients. And that isn't just the doctor, wouldn't you agree? It's every single person in the practice. At Jameson, we believe that every single person on the team is as important as every other person on the team. And so whether I'm the person in the business office, whether I'm the clinical assistant, the hygienist, the doctor, it doesn't matter. That my relationship with the patient may make the difference as to whether or not this person goes ahead with treatment and or not. So every interaction, every single interaction that we have with the patient makes a difference. So building a relationship of trust and or confidence, or both, building the relationship. The second step is to establish the need. This is where we will be certainly doing the diagnosis. You'll be gathering diagnostic information about the patient, and hopefully you're doing a very comprehensive diagnosis, and hopefully you're doing the same comprehensive diagnosis on all of your new patients. However, there's also another aspect of establishing the need, and this is to establish the felt and or perceived need of the patient. And this is where your communication skills become absolutely essential. Because again, I'm going to repeat this, people come to you because they want and or need something. Otherwise, why would they be coming to the dentist? Obviously, they want and or need something. So it's through excellent communication that you will determine what is that person's perceived need. What is it that has brought them to you? So it's asking questions and listening, being an excellent listener so that we can find out what it is that has brought them to you. My husband loves to ask the question, Mrs. Jones, tell me, what are your goals for your mouth, your teeth, and your smile? I think it's one of the best questions. I actually learned that question from a client of mine many years ago, brought that home, taught that to my husband, and he used that question as an introductory question with all of his patients. Mrs. Jones, tell me, what are your goals for your mouth, your teeth, and your smile? And all kinds of interesting things would evolve. Sometimes people have to sit back and think about that because they haven't ever been asked that question before. And sometimes they didn't know. So he would say, I understand that. That's just fine. Now I'm going to provide a comprehensive evaluation of your mouth and your teeth and your gums now. And at the end of my evaluation, I'm going to show you some photographs. And then I'm going to ask you that question again. So you just think about that. And if you would come back to that question at the end of an evaluation, no one ever failed to be able to answer that question. So establishing the need, very critical. The next step in the effective case presentation is to educate and motivate. And my husband would add to that, educate, motivate, and activate, because we want to activate that patient into going ahead with treatment. So this is where you will do your presentation, and I'm going to go into that in more detail as we proceed. But this is where you'll be actually presenting your recommendations. And I'm going to give you some variety of ways to present your recommendations to the patient. The next step, step 4, is to ask for a commitment. This is where you will be actually, I'm going to use this term, you'll be closing. What you're going to be doing is you're going to find out whether or not the person is ready to proceed, or whether they have objections or barriers or things that might be getting in the way of them saying yes to treatment. Well, this is a good thing to know. You want to know if there are objections, because an objection is actually a request for further information indicating to you that the patient is interested in what it is that you are proposing. This is good news, because if they didn't present an objection, that would mean that they're not interested. Well, we want them to be interested. So when you are learning to ask for a commitment, you're either going to get a yes, or you're going to find out that the patient may have questions, and that gives you a chance to answer those questions. You want to get those things out on the table for open communication to take place. The next step is to make financial arrangements. Making a financial arrangement, getting a financial agreement to both the total investment that a person will be making as well as the method of payment, that always precedes the scheduling of the appointment. Always. I don't care if it's a single occlusal restoration or a full mouth reconstruction case. You always want to make sure that the patient is both clear and comfortable with the financial responsibility prior to the scheduling of the appointment, and certainly prior to the rendering of care. So those are the 6 steps of case presentation. Let me just say this one more time. All of the systems of your practice are a series of steps. Step 1, step 2, step 3, step 4. Very similarly to your clinical procedures, you have procedures for all of your clinical treatments that you provide. And you have step 1, step 2, step 3, step 4, etc. And you follow those steps in order because you want and expect to obtain an excellent result for your patients. Well, the same thing is true with your management systems. Step 1, step 2, step 3, step 4. You follow those steps because, again, in your management systems, you want and expect to get excellent results. And so in case presentation, same things follow suit. If you follow these steps, you're going to have a much higher case acceptance ratio than if you don't. So let's go on. Historically, you have probably had this kind of a scenario. You may have had a treatment coordinator in your practice, which I'm going to address fully. And it may be that the doctor presents the clinical recommendations to a patient. in hopefully a non-clinical area. And then a treatment coordinator would either give the doctor third-party backup support and then would make financial arrangements. That this is a good scenario. If possible, we like for the presentation of recommendations to be out of the clinical area. Some people don't have this ability in their facilities, and so they do present right at the chair. So this is a scenario that historically you may have had happen in your own practice. With recent changes with COVID-19, this may look very strange to you now because you notice that they're pretty close to each other, they're not masked, et cetera, et cetera. So this may not be the norm at this time, but this may be what you had seen in the past. The point of this slide is that we want to have a presentation of recommendations to patients. Now, you may not have a place in your practice where you have been presenting your recommendations in a non-clinical area, but we would like for you to be able to get out of the clinical area to present your recommendations if possible. This is a practice in which we work. And when we first started working there, the doctor did not think that she had an area that was appropriate for consultations. She had a private office, and this is what it looked like. There were shelves, and she had a desk, and as you can see, the paintings were taken off the wall for this photography. But this is what the office really looked like. And she didn't think that this was a conducive place to present her recommendations. And she was probably right. But with a little bit of change and a little bit of reorganization, this is what we changed it into. Very modern. You can see the peninsula table, a place where she could sit, a place where the patient could sit, the patient and or another decision maker could sit, the big monitor, a large monitor at the end of the table, very conducive to what she wanted to do in terms of her presentation. And it has worked very, very, very well for her. Just a little bit of change and not a lot of money invested, but it really has worked well for her. And so again, make some changes in your own practice, and it could work. It could work for you too. So just some small things. So consider. And again, you may think, I don't have a place in my office that could work, but you might find that you do. So there are different kinds of consultations. And because of the changes that we have seen in recent times, we are recommending 3 different types of consultations. So you may find that one or a combination of these fit for you. So let me describe these to you. Same-day consultations, virtual consultations, or what we're going to call an invitation consultation. So let me describe these in detail, if I may. A same-day consultation could be where a patient comes in for an evaluation. They may come in for a hygienic appointment and the doctor identifies some necessary care, or they've come in for an emergency and you identify necessary care. There are you can imagine, various and sundry situations where the doctor identifies need for treatment and you have the time to provide that care without that having a negative impact on your regularly scheduled patients. And the patient has time to receive the care and they don't want to get off work again. They've already gotten off work. They've driven across town. They have childcare already lined up, etc. And so for the convenience and for the issue of time, they would like to get this done today. And for you, you're already scrubbed up. You already have the PPE. You're already with the patient. For all reasons, you'd like to go ahead with care that day as well. So this might be appropriate for you. You still want to talk to the patient about what's going on. You want to show them with your visual aids the situation in their own mouth, and you still want to have a discussion with them about the financial responsibility. And you can do that at the chair. Now, in this photograph that you're seeing, you can't really tell from this photograph, but there is plexiglass between this patient and the financial coordinator. Patient is wearing a mask. and the financial coordinator is not wearing a mask, but she does have plexiglass between she and the patient. So, you can have a financial discussion in this situation, or if you're going to invite the financial coordinator back to the clinical area, remember she'd have to be protected. So you have to remember all of the protection issues that have to go on anytime you're making a change from one room to another or from one person to the other. So bear those situations in mind. All of those things have to be taken into account anytime you're making changes from one space to another, one room to another, and even one person to another. So there are some benefits to the same day consultation. And again, remember also that people have been out of work for a long time. And so going back to work is of benefit to the patients. And now getting off work again for dental appointments is not always easy for all people. So there are some benefits to the same day consultation. And you may in some situations go ahead with treatment. I'm not suggesting that always you'll go ahead with treatment, but you may do the consultation on the same day. So I hope I'm separating those two things. So again, you may have done a diagnosis. You may have presented your recommendations on the same day. And in this illustration that you're seeing on the screen now, this person is making a financial discussion on the same day. In this, for purposes of this photograph, this person would be scheduled back more than likely for the treatment to be provided. But if you're going to provide care on that day, those things still need to be taking place. The presentation of recommendations, the presentation of the finances, and then again, you have to be careful about any kind of coverage. So I hope that makes sense to you, but this is a possibility. Another kind of consultation is the virtual consultation. We were recommending this actually before COVID-19, but this is even more impactful now that we have altered so many things because of COVID-19. The virtual consultations, whereas historically, while same day consultations have always been a possibility and have always been good, the visit back, which I'm going to talk about in a minute, having patients come back for a consultation gives the doctor time to plan the consultation, gives the financial coordinator time to plan for what she's going to be discussing, etc. It's always a great thing to do. Now that's not as easy as perhaps it once was. And because time and convenience are such an issue for people, the virtual consultations are a good alternative. Again, you have to be very, very well prepared, and you have to use wonderful visual aids, particularly for photography, because you're going to be presenting, and I'm going to go through the steps. You're going to be presenting to the patient just as if they were with you. So you have to be prepared. You cannot waste your time or theirs, and you're not going to have the benefit of having that patient with you. You're not going to have the benefit of seeing their body language or reading their body language, or many things that you would have the opportunity to be seeing if they were in your presence. But these are still wonderful opportunities, the virtual consultation. So be ready, use whatever software you think is appropriate for you, Zoom or Skype or whatever is appropriate for you, but you have to be prepared. You have to be well prepared, and you want your patients to be prepared as well. So here's another example of that was a client of ours in Dallas. This is another one of our Dallas clients, again, presenting to the patient from a very well prepared treatment plan, very good visual aids, making sure that the patient has what the patient needs and that they are together for the presentation and everything is clear and precise. So again, the virtual consultation is here. Again, it's very time effective and it's very convenient. So the benefits are miraculous. So make sure that your patients are ready, tuned in, clear on when, where, and how they're going to be performing with you or participating with you. Now, the invitation consultation, again, this slide would be different now. You'd have a little more distance between the patient and the doctor, and you see the treatment coordinators opposite the doctor. So the distance there is fine, except you'd probably have masks on, actually, in today's world. But this would be where you actually have a patient come to the practice to have the doctor and or treatment coordinator actually present recommendations with the patient in their presence. For larger cases, comprehensive cases, cosmetic cases, whatever it may be, this is still a good option where the doctor has time to really plan the case, what he wants to do, where he wants to start, how many teeth he wants to work on, the total comprehensive case, where the treatment coordinator will have a chance to also know what the doctor's going to do, to be able to provide third-party backup support, as well as plan the financial aspects, any insurance ramifications, what kind of financing options would be available and what third-party financing might be recommended for the patient, etc. Everything would be, they would have time to plan this and present this. Now, that would be true on the virtual consultation too. You'd have time to plan everything very carefully. The only difference between the virtual and this one is virtual, it would be obviously digital, and this one would be in the present. So those are the three differences of the consultations. Now, let me step back a little bit. When you are providing an evaluation for a patient, whether this is a new patient or whether this is a patient of record, where you are actually doing a comprehensive evaluation, or whether this is a patient that has come to you and they have quite a bit of treatment that may need to be provided, and you want to have some time to review the data that you're gathering, and you do want to have them back either virtually or in your presence to do a consultation, I'd like for you to consider these verbal skills to invite them for that consultation. Something like this. So let's say it's Mrs. Jones. Mrs. Jones, I need some time to review the data from today's evaluation to design a treatment plan that I believe would be best for you. And then I'd like to invite you back to the office in a week or two so that we can sit down together uninterrupted to review my recommendations. Would that be acceptable to you? Now, you can change that to say, I'd like to invite you to join me in a week or so, to join me digitally for a virtual consultation so that we can join together to review my recommendations. So again, you would alter those verbal skills depending on whether you're going to do a virtual consultation or a face-to-face consultation, if, again, you need some time to review the information. Because again, sometimes you can do that same day consult if there's not a lot to be done. But if you're gathering a lot of information and you really do need to evaluate that to design a comprehensive treatment plan, give yourself permission to do that, and then invite the patient to join you so that you can be really prepared. The better prepared you are and the better prepared your treatment coordinator is, the more likely you'll get a yes to that patient moving ahead. A slam dunk is not always the best option. So one other question you want to ask the patient, and this is a critical question, is, Mrs. Jones, besides yourself, who will be deciding how, not if, how you'll be proceeding with treatment? Now, what you're looking for there is you're looking for the decision maker. There is no reason to call for a decision if the decision maker is not there. So please remember that. There's no reason to call for a decision if the decision maker is not there. You're wasting your time and you're wasting the patient's time. Because if they say, oh, you know what, let's say that you've presented your recommendations and you've used your visual aids and you've done a great job, and now you call for a decision, and the patient says, you know what, I've just got to ask my husband about this. I don't know about this. I've got to ask my husband about this. And the husband hasn't heard a word you've said. The husband's not there. Do we honestly believe that if a patient has heard your presentations once, that they can now go to their spouse and repeat to the spouse what you have just said and give their spouse a clear description of what you have described as necessary care? Can they even remember what you just said? Even if they had a treatment plan in their hands, can they decipher that? I think you'd agree with me that the answer to that is probably no. So to the best of your ability, you ask this question, is there anyone besides yourself who will be deciding how you proceed with treatment? Oh, well, yeah, my husband and I, we make all of our decisions together. Okay, well, great. Then let's arrange a time when both you and your husband can join me for our digital or virtual presentation, where the two of you can gather around your computer and I will present my recommendations to both of you, or in the office, as it were, whichever choice you make. And I think you'll find that you'll have much better results. So consider that. Remember, we're going to educate, we're going to motivate, and our goal is to activate. Our goal is to whatever your case presentation recommend ratio is right now, we want to increase that. Research has shown that no matter what your retention ratio is right now, that if you increase your retention ratio by 5%, you increase your profit margin by 45 to 65%. So you want to increase your retention ratio both in hygiene, and you also want to increase your retention ratio of your case presentation. You want more people saying yes to the recommendations that you're making. Now, you've heard me say this several times, and I'm going to keep saying this. You want to use visual aids. So I'm going to recommend that you use your cameras on every single patient every single day. You want to show people new areas of concern. Of course, for all your new patients, you would want to gather not only radiographs, but you want to gather photographs of that patient's entire mouth. We always use the AACD photographic series on all of our new patients, and that was a part of their record. And then we could always go back to that. And then any individual teeth that had problems or areas of concern, those would be added to their record as well. But you always want to look at dentistry diagnosed but incomplete on every visit, whether it's a hygienic visit or whether it's a visit of any kind. Any dentistry diagnosed but incomplete, you always want to go back to revisit that and show that to the patient to make sure that they know that there is dentistry left to be completed. Number two, you want to see if there's any new areas of concern. So you'll always want to take a tour of the mouth with the cameras to see if there's any new areas of concern since the last appointment. Again, hygienically or in the restorative area. You want to always be evaluating periodontal concerns. There's so much periodontal disease in the mouths of American adults throughout the world, actually. And so we want to make sure that we are attending to those periodontal needs. So be evaluating those on a regular basis. You want to look at, and you see examples on this particular slide, old restorations that have served their purpose well, perhaps, but they are no longer serving their purpose. And so there are areas that could benefit from advanced restorative treatments, inlays, onlays, crowns, bridges, so many new opportunities. Same day dentistry, perhaps. As example here, I'm sure you can see there's some needs in this person's mouth for sure. And also aesthetic opportunities. The surveys done by many groups have shown that about 50% of Americans, when asked, about 50% of people say that they would like to change something about their smile. So let's ask. Let's show people at least their anterior views. You could show them all of their views of their mouths, anterior and interior views, and ask them if there's anything they'd like to change about their smile. And you'll be surprised at how many people would say yes. So those 5 areas alone you can show with visual aids. And while there are many kinds of visual aids, there's nothing that is better than photography. So ask yourselves, are we using our photography to its fullest degree to help people see what's going on in their mouths and show them befores and afters of dentistry that you have provided to show them not only the features of what you're talking about, the benefits of the type of treatment that you're recommending, and proof that you can produce those kind of results. When you're talking about communication, and there's so many different ways that we communicate, but look at this slide and let me share this with you. About 55% of all communication is body language. What we're doing with our face, with our hands, with our body, how we're moving, expressions that we use. About 38% is the tone of voice. how we are expressing ourselves with our words, again, through the tone of our voice. About 7% are the actual words we speak. So while the words we speak are very important, I've given you some examples of verbal skills right now. And so the words that you speak are very, very, very critical. You can say something one way and get a very positive response, and you can say something another way and get a negative response. So I do think that the verbal skills are very, very, very important. However, I can have the best verbal skills in the world, but if my tone of voice is boring or monotonous or uninteresting, or if my body language is like, oh, I really don't care about what's going on at all, it can blow the whole thing. So we do want to pay attention to this. So it's very critical when we're face to face with people. But if we are not going to have the opportunity to be face to face with people and to read their body language, or for them to read us, and if we're going to be doing things virtually, we really have to pay attention and and watch ourselves, record yourself, look at yourself, listen to yourself, practice, get feedback from others, and do that with your face to face. If you're practice with somebody face to face, and get someone who is a caring, honest person to give you feedback and some coaching, and then also do that virtually and say, how do you come across virtually? Are you going to keep their interest? Now, remember this also, attention span for an adult in a consultation experience is about 15 to 17 minutes. So that's one of the reasons why you have to be so well prepared, because you aren't going to keep attention very long presenting dentistry to someone. So you've got to be very well prepared, and you've got to be interesting. So ask yourself, do you even interest yourself, or do you bore yourself to death? So you've got to be interesting. And so, bear this in mind, this slide itself, and ask yourself, what do I look like? Am I well groomed? Do I have facial expression? What's my voice like? And again, that's not just for the person presenting the clinical dentistry, but it's the person who's presenting the financing and scheduling as well. So a lot to think about. I know, a lot to think about. So let's think about that treatment coordinator, financial coordinator, this person who is going to be talking about the financing. Now, this person also, remember, and I've said this several times, I'm going to say it again, this person could present the clinical dentistry. The doctor is the only person who can diagnose and design the treatment plan. Obviously, the doctor is the only person who can diagnose and treatment plan. However, the doctor is not the only person who can present recommendations. The person who should be presenting the treatment plan or the recommendations is the person who presents it the best. And that might be somebody other than the doctor. That's okay. So whoever is going to be presenting the clinical dentistry, and or the person who's going to be presenting the financing and scheduling the appointments, whoever that person is, could be one person, could be two, this person needs to have clinical knowledge. I served as a treatment coordinator in my husband's practice. I am not a dentist. I did do clinical assisting for him. I'm not a hygienist. I did do clinical assisting. But I know a lot more about dentistry than the patients do. So I do have clinical knowledge. So I could present the clinical dentistry, although he usually presented the clinical dentistry. And we had smaller cases, our treatment coordinator usually presents the clinical dentistry and makes the financial arrangements. On larger cases, he would present the clinical dentistry and we would make the financial arrangements and then schedule the appointments. That's just the way we did it in our practice. You do it whatever works for you. But clinical knowledge means that we can answer questions the patients have. We may need to go back to the photography on our monitor to show people what's going on in their mouth, to show before and after photography, to give illustrations about what the doctor is recommending. Clinical knowledge. Have a confident personality, and certainly they need to believe in quality dentistry, optimum oral health, and we need to believe in our doctor, and that what our doctor is recommending is what's best for that patient. And we need to be passionate about that. We need to be a very good communicator and be able to present the recommendations in a very in a very constructive and positive way. But most of all, we need to be a good listener. We need to be able to, if we're in the presence of a patient, we need to be able to read that body language. And if that patient sort of pushes back or crosses their arms and or shows any signs of discomfort, or if they become uncomfortable, I need to stop and say, seems like something may have been confusing, or you may have some questions. That's okay. Let's stop and let's go back. What was confusing? I need to be able to listen to that body language or any words that they say. The better communicator I am and the better listener I am, the more that patient will share with me. Very, very critical. I need to be persistent. I need to, the first time somebody throws an objection my way, I'm not going to back off and say, oh, well, they didn't want it. They didn't want that. I could tell they weren't going to go ahead. I need to be persistent. Mrs. Jones, this is the type of care you'd like to receive, right? You have some concerns. Let's discuss those one at a time. I need to be persistent, and I need to be persuasive. I'm not going to back off too quickly. My goal is to get a yes. If I'm going to gain acceptance, I'm always going to be presenting in a private situation. I am not going to break HIPAA by talking about dentistry or finances in front of everybody at the front desk. I'm going to do my very best. Remember my opening slides. Find a way in your practice to make it possible to discuss both the dentistry and finances in private. We use my husband's private office. Okay, well, he didn't need to be there anyway. He needed to be back doing dentistry. So find a place. Do whatever you need to do. We've taken little closets and turned them into nice little consultation areas and practices before. Find a space that you can have as much privacy as possible. The person that is making financial arrangements needs to be in professional attire. This is a business discussion. And so, in our opinion, the treatment coordinator or financial coordinator needs to be in business attire. If you are in a very large organization, if you're the financial coordinator or treatment coordinator, you may not have met the patient before. This is happening in a lot of very large organizations. That's okay. Make sure that you're introduced, or that you introduce yourself, and that you personalize this conversation as much as possible. Have all necessary information at your fingertips so that you don't have to get up and go out and leave the patient alone. That breaks the energy between the two of you, and that's the last thing you want. Again, you're going to watch body language for any discomfort. Stop, find out what's going on, clear the air, clear any questions, clear that discomfort, and go on. The human mind can only think of one thing at a time. So if a patient is upset or confused about something, their mind is going to stay on that, and whatever you say next, they're going to miss it. So don't just go on and on and on to get through it. Stop and listen, clear the air, clear the question, and then move on. So remember, listening may be the most important of all your communication skills. So I've talked about verbal skills. Practice, practice, practice. And remember this about verbal skills. Think about the common kinds of objections your patients will present to you, whether that's about safety, whether it's about cleanliness, whether it's about COVID-19, whether it's about financing, whether it's about scheduling, whatever kinds of objections or concerns a patient might present to you. And think about the most positive and constructive ways you can address those. And if it were my practice, I would write out verbal skills. I would work on that as a team. And then we would practice those verbal skills with each other so that we all have what we call linkage communication. It doesn't mean that we all have to say things exactly the same way, but the message needs to be the same throughout the practice so the patients are hearing the same message. So you're hearing the same message, and you're using good visual aids for whatever it is that you're doing in your practice so that people are getting a clear, succinct message throughout. You're going to have a better chance of having a higher level of case acceptance if the message is clear, succinct, and if you're using visual aids. Let me say this about visual aids also, that there are different ways that people learn: visually, auditorially, and kinesthetically, as you see in this illustration. Visual learning accounts for approximately 83% of learning. And I think you'll agree, we're teaching people here. We're teaching them about what's going on in their mouths. We're teaching them about what it is that you're recommending that they do to restore their mouths to health again. You're teaching them about the opportunities that you have available in their practice. So you are in a teaching scenario. Remember, educate, motivate, activate. You are teaching. So if you want to teach and you want people to learn, you want to use the very best teaching tools. And so if 83% of learning takes place visually, that is why you want to use as much visual aid as possible. And again, nothing is better than people seeing photographs of their own mouths. And I'm going to say this again, that your photography will show features. This is what a crown is. This is what a bridge is. This is what a veneer is. This is what a composite is. This is what a person had in their mouth when they had a quadrant of old amalgams. And this is before, and this is what it looked like after when we removed the old amalgams. And this is what it looked like when we replaced that with beautiful composite restoration. Don't just tell them, show them. So they're showing the features of what composite is. You're showing them, they see the benefits of that. And you're showing them proof that you can produce those kind of results. Features, benefits, proof. So while you can buy professional photographs, there's nothing like having your own. You need a library of your own photography and have it at your fingertips so that you can show people. Auditory accounts for about 11% of learning. So that's where your verbal skills are very valuable and critical. Kinesthetic accounts for the rest. So 83 visual, about 11 is auditory, the remainder kinesthetic and or the other senses. So there you have it, teachers. So again, I can't say enough about photography, and there's so many ways you can use photography, not only in your practice, but in your marketing as well. So your photography will be a part of your practice for a long, long time. So when you're presenting your dentistry, again, whether that's the doctor presenting or whether this is the treatment coordinator, you want to show people this is the diagnosis, this is what's going on in your mouth, and show them. Then you want to show them, this is what I'm recommending that we do to restore your mouth to health again. And this is where we recommend that you show them a before and after. Mrs. Jones, let me show you a similar situation. This person had a situation very similar to yours. Can you see the similarity here? Great. Once we completed her treatment, she looked like this, and then show the after. Now, Mrs. Jones, is this the type of treatment you'd like to receive? That's called the similar situation close. Show them their mouth. Let's say they have a cracked tooth. Mrs. Jones, this is a tooth in the lower left part of your mouth. It's cracked. Can you see the crack here? This is what's going on, and this is my concern. So talk to her about that. Let me show you a similar situation. Now you come up with your before of a similar situation, another patient that had a cracked tooth. This person had a tooth that was cracked, very similar to yours. Can you see the similarity here? Oh, yes, I see that. This is what she looked like when I finished her treatment. Boom, and you show the after. Do you see the similarity? Yeah, I see that. Now, how do you think this looks? Oh, that looks great. Yes, we were able to save her tooth. And if you want to, you can show the tooth 5 years later, or 10 years later, or whatever. Now, Mrs. Jones, this is what I'm recommending that we do. So you've shown her the advantages of proceeding, and you've talked to her about that. Now, you can, if you could talk, and you can tell her about the disadvantages of not proceeding. In fact, I recommend that you do that. If we don't save this tooth now, you run the risk of that tooth cracking and splitting and losing the tooth totally and completely, which could lead to a need for much more advanced and extensive treatment. And that you don't want that. We want to do this as conservatively as possible. We want to save this tooth. Wouldn't you agree? Yes, I do. So then after you've done these 4 steps, then you want to find out if this is the kind of treatment that they want. You want to ask for a commitment. And so we're going to close. So if this is the type of treatment you want, do you see any reason why we shouldn't go ahead and schedule your first appointment? I'm looking for objections. I'm looking for problems. I'm looking for reasons she wouldn't go ahead. Don't just say, well, do you have any questions? No, I don't have any questions. My husband used to say, he used to do that. He'd say, I'd ask a patient if they had any questions, and they'd say no, and I'd think I'd done just a great job. And so I'd I'd leave, I'd go back to the chair, and then I'd wonder why I never saw Mrs. Jones again. Well, he said, I had to learn to close. I had to learn to get any objections out on the table so that we could deal with those right then and there while we were in the presence of the patient. You could turn this question around a little bit. Well, Mrs. Jones, if you have no further questions, because it's okay to say, do you have any questions? No, I don't have any questions. Then shall we go ahead and schedule your first appointment? Well, I don't know how much it's going to cost. Right. So if you have no further questions, I'm going to have Kathy, my treatment coordinator, discuss the financial responsibility and the options we have available for payment right here in our practice. Once you work out the financial aspect of care, is this the type of treatment you'd like to receive? There's another closing question. Once you and Kathy work out the financial arrangements and come to a financial agreement, is this the type of treatment you'd like to receive? Or does this treatment plan work for you? That's another closing question. So her objection or her question was money, which usually it will be. Money's the number one reason people don't go ahead with treatment. So, okay, great. I want to know that. Do you need more information, Mrs. Jones, or have I told you enough to make your decision? Well, I have a few questions I need to ask. Great. And whatever those questions are, how long will this take? How much is this going to be? Will this hurt? How long will this last? There's going to be questions that they ask. That's good, because any questions the patient asks you are giving you the indication that they're interested in what you're proposing. So you want them to ask you questions and give you a chance to answer them. Is this the type of dental care you'd like to receive? Well, yeah, as long as I know this is going to last a long time. So lasting a long time is very important to you. Is that right? Yes. Well, let's discuss that. So again, whatever they ask you, repeat it to them and then answer the question. These are closing questions, and this is the way you proceed. This is the way you move ahead. It's very critical that you track this. You want to track any dentistry that you have recommended, and whether or not the patient has proceeded with that treatment and or not. You can do this with your software. You can do this, your softwares are great with tracking this, because one of the critical factors of the business of dentistry is tracking how much dentistry has been diagnosed and how much is left to be done. We call these key performance indicators, KPIs. Any business will tell you that you want to have a good handle on your KPIs. You want to strategize, you want to set goals, and you want to measure. That which is not measured cannot be monitored, or that which is not monitored cannot be measured. You can say that either way, because only if you set goals and you're measuring whether you're reaching those goals or not, can you innovate or change or set higher goals or grow, and then propagate and continue to develop your business. And the more you engage your entire team in setting goals, because people in the workplace today want to be involved in setting goals. All the research shows that. And they want to be a part of making those goals come to fruition. So let people know the status of the goals along the way so that they can help you clean up systems that aren't working very well or maximize systems that are working well. So what are the key things to look for in practice? Well, obviously, your daily production, your case acceptance, which I indicated, your retention, your patient retention, your hygiene production, collections, accounts receivable, all accounts receivable, particularly, hopefully you don't have any accounts receivable over 90 days. You want to look at all your accounts receivable, no-shows and cancellations, how many of those are rescheduling, adjustments, a critical thing for you to look at, cash flow, break-even point, that would be your profit and loss, and hopefully your budgeting. And you're looking at that very carefully. Number of new patients and your number of referrals. Those are some monitors that you would want to be looking at every day and every month. Of course, your software will help you with that. There's a lot of the software experts will say that most practices are only using 17 to 20% of their software capability. So Continue to have training with your software and dig into that software. Use your Excel sheets, use your dashboards, use accounting programs, your business accounting programs to really dig in and set up your own monitors, your own KPIs, your own goals, and make sure that you are monitoring the things that you want to be watching to make sure that you are always on top of making sure that your practice is where it needs to be and that you're always moving upward. There is no such thing as status quo. You're either going up or you're going down. So you got to monitor to make sure that you're always going up. Now, we've had a really weird 3 months with the COVID-19. And so the last 3 months are not going to be indicative of what your practice has been doing historically. But look at the last 3 months and look at your gross production, your net. That would be, what your production may be if after you have, if you're in any PPOs where you're reducing your fees, that would be your net production. Well, you're collecting, and you should be able to add your collections and adjustments, and that should give you your gross production. And from this figure, what is your monthly average? And how many days did you work? How much is each provider working? How many days? And then how much is each provider producing? Those are some things you want to look at for the present moment, but also be looking at that throughout the year. What did you produce last year? What are you producing so far this year? Again, it's going to be pretty weird right now, but look at your average per month, but then look at the last 3 months. And if it were my practice, I would want to look at let's say the last 3 months, even before COVID-19, to see what, say, the first 3 months of 2020, what did you produce then versus the second quarter of 2020, because we know that then the third quarter and hopefully the fourth quarter, surely, of 2020 are going to be great. You want to look at the production of each provider. You want to look at the whole practice, but you also want to look at the production of each provider individually. And you want to set goals for each provider. You want to set goals for your practice, but you also want to set goals for each provider. And then how many days are you working per month? Then again, average production per day for the total office, and then for each provider, and do the same thing in hygiene. What is your goal for hygiene? And then what is your goal for each hygienist? And then what are they producing? So are they reaching goal, each provider? Do the same thing for collections. What did you collect last year? What have you collected so far this year? And what is your 3-month average? And then do that first quarter, second quarter, and then look at the third quarter and the fourth quarter. I have seen practices going back to work now in the states that have opened up in May. And I'm telling you, most practices are reaching goal right off the bat. I'm thrilled to see production going very well so far. Not all states are opened up, but the ones that are seeming to do well. So be careful tracking these things and track these things right off the bat. And I think you'll see, if you're planning carefully, I think you'll see things go up rapidly, even though you may be seeing fewer patients. We have what we call the model success, and it's very appropriate for now. See fewer patients in a day, do as much dentistry as you possibly can per patient, and see the patient for fewer visits. Your patients are going to love you for that. It's going to be a better way to practice. It's going to be a way you have to practice. You're going to spend more time per patient because all the appointments are going to take longer because of the PPE and everything else. You may be using your team in different ways than you have in the past. So a lot of things have changed, and you've already had some webinars on scheduling, so pay close attention to those scheduling alterations that are imperative. And fees may change as well. Some of the coding is changing as well. So a lot of changes continue to go on. Be ever apprised of those changes. So watch these numbers. I think you're going to be just fine as the year proceeds. So what is your collection? Divide the numbers collected by the numbers dollars produced, and that will give you a percentage. Now, in terms of your case acceptance, remember I said it's the fulcrum of your practice. So these are things you want to track. Are you doing complete treatment planning on all patients? Ask yourself these questions. These are critical questions. Are your case presentations excellent and successful? What is your percentage? The ADA recent surveys, this is 2019 numbers, but they said that the average case acceptance ratio is 61%. I find that appalling. Hopefully your case acceptance ratio far exceeds 80% or more. and you want to get it up that high or higher. Are you tracking dentistry diagnosed with incomplete? If you aren't, please do. And have you developed the role of treatment coordinator? And are you tracking your hygiene retention? We call this the lifeblood of your dental practice is your hygiene department. So are you really apprised of this? We want 85 to 90% of your active patients actively involved in hygiene. We're going to use the ADA data for this. ADA says that an active patient is somebody who's been in a unique patient who's been in your practice in the last 2 years to receive treatment. So those are your active patients. You want 85 to 90% of those people actively involved in hygiene. About 33% of your overall practice production should come through the hygienic area with some type of treatment, whatever that treatment may be. And 40 to 60% of the doctor's restorative and or aesthetic dentistry should come right out of hygiene. And if you're using your cameras in the way that I described earlier, you'll see that that is true. And I want you to track that because that's where the majority of your restorative and or aesthetic dentistry should be coming from. But use the cameras and give your hygienist permission to use the cameras and time to use the cameras and to educate your patients. 50%, 40, 50, or more percent of the hygiene production should be periodontal in nature. So look at your production report, which, it's all the ADA codes that'll come right out of your software, and look at your 4,000 codes and see how much of your hygiene productivity is periodontal in nature. Track your new patients. How many new patients did you have last year? How many so far this year? What is your average number per month? And then how much dentistry is being diagnosed per new patient and how much of that is being provided. How much, again, of the dentistry being diagnosed is being accepted. That'll tell you how many new patients you need to be marketing for. So when you follow these criteria for case acceptance, and when you're really looking at the critical factors of the practice of dentistry and you're tracking things appropriately, when you compartmentalize and you really focus intently on the things that make a difference, and when you really work towards stabilizing your practice, when you look at retention of your hygiene patients, and when you really nurture the hygienic aspect of your practice and you build from your hygiene area and you move patients from hygiene into the restorative area of your practice and you accelerate the number of patients that are saying yes to treatment, you will not only stabilize your practice, but you're going to maximize your opportunities that lie within your own practice, because you can build your practice from within by maximizing your own patient family. And you can build right from where you are today. Compartmentalize, stabilize, and maximize. Patient consultations, case presentations, and managing the health of your practice. There's so many wonderful things to do to build your practice, and it's been such a great opportunity for me and for all of us at Jameson Management to share some time with you and give you some insights into building your practice. Again, thanks to Henry Schein and to Dental Business Institute for giving us this opportunity. If you'd like to hear more about the opportunities that we can provide for you at Jameson Management, we'd love to speak with you or to hear from you and to answer any questions you might have about your own practice, and for us to share with you some things that we have going on at Jameson Management. Please feel free to contact us at 877-369-5558 or contact us at info@jmsn.com. Certainly, you can also go to our website at www.jamesonmanagement.com. We'd love to hear from you. Good luck. We're here for you for anything you might want to have a conversation about your practice. Our best to you now and always.